Alcohol. Alcohol is the most widely used depressant in the world. It slows down the central nervous system, which is why people feel relaxed, less anxious, or more social after drinking. It has been part of human culture for thousands of years, used in celebrations and rituals. In small amounts, it lowers inhibitions, but in higher doses, it impairs judgment, coordination, and breathing. Because it is legal and socially accepted in many places, its risks are often underestimated. Nicotine. Nicotine is a fast-acting stimulant found in tobacco plants and delivered through cigarettes, chewing tobacco, and most modern vapes. Once inhaled, it reaches the brain in seconds and triggers the release of dopamine, the chemical linked to pleasure and reward. That quick reward is what makes nicotine highly addictive. In the short term, it increases heart rate, raises blood pressure, and can create a brief sense of focus or calm. Over time, the body builds tolerance, which leads to stronger cravings and frequent use. Long-term smoking is strongly linked to lung cancer, heart disease, stroke, and chronic breathing problems. Even vaping, often seen as safer, still exposes the body to addictive chemicals and can affect lung health. Cannabis. Cannabis comes from the cannabis plant and contains THC, the compound that produces its psychoactive effects. After use, THC interacts with the brain's endocannabinoid system, which influences mood, memory, appetite, and pain. Short-term effects can include relaxation, altered sense of time, increased appetite, and heightened sensory perception. Some people also experience anxiety, paranoia, or impaired coordination. With frequent use, especially during adolescence, cannabis may affect memory, learning ability, and motivation. While it is less likely to cause physical dependence compared to drugs like opioids or nicotine, psychological dependence can develop. In medical settings, cannabis or related compounds are sometimes used to manage chronic pain, nausea, or certain neurological conditions. Cocaine. Cocaine is a powerful stimulant derived from coca leaves. It works by blocking the reabsorption of dopamine in the brain, causing an intense buildup of pleasure signals. The result is a short-lived burst of energy, confidence, and euphoria that typically lasts minutes rather than hours. Because the high fades quickly, repeated use in a short time is common. Short-term risks include rapid heart rate, high blood pressure, reduced appetite, and increased body temperature. In higher doses, it can cause panic, seizures, or heart attack. Long-term use may damage the heart, brain, and nasal tissues if snorted. Cocaine's strong psychological pull makes addiction a serious risk. Heroin. Heroin is an illegal opioid made from morphine, originally derived from the opium poppy plant. When it enters the brain, it binds to opioid receptors responsible for pain and reward. Users often describe a sudden wave of intense pleasure followed by heavy relaxation and drowsiness. Because it slows breathing and heart rate, overdose is a constant danger. The body can develop dependence quickly, meaning withdrawal symptoms such as severe muscle pain, nausea, sweating, and anxiety appear when the drug is stopped. Long-term heroin use increases the risk of infections, collapsed veins, and serious organ damage. Its impact on both physical and mental health can be severe and long-lasting. Prescription opioids. Prescription opioids include medications like oxycodone, morphine, and fentanyl, designed to treat moderate to severe pain. They work in the same way as heroin by attaching to opioid receptors in the brain. When used under medical supervision, they can provide essential relief after surgery or injury. However, they also produce feelings of warmth and well-being, which can encourage misuse. Over time, tolerance develops, requiring higher doses to achieve the same effect. Misuse can lead to dependence, addiction, and life-threatening respiratory depression. In many countries, high prescribing rates have contributed to widespread opioid addiction and overdose deaths. LSD. LSD is a synthetic hallucinogen that powerfully alters perception and thought. It affects serotonin receptors in the brain, which play a role in mood and sensory processing. After taking LSD, users may see intensified colors, geometric patterns, or visual distortions. Time may feel slower or faster, and emotions can become amplified. The experience, often called a trip, can last 8 to 12 hours. While LSD does not typically cause physical addiction, it can lead to unpredictable psychological reactions, including panic or paranoia. In rare cases, people experience persistent perceptual changes or flashbacks long after use. Methamphetamine. Methamphetamine is a highly potent synthetic stimulant that strongly increases dopamine release in the brain. It produces intense energy, alertness, and a feeling of power or confidence that can last for many hours. Because of its long duration, users may stay awake for extended periods, sometimes days. Short-term effects include increased heart rate, reduced appetite, rapid breathing, and elevated body temperature. Repeated use can lead to severe weight loss, dental damage, skin sores, anxiety, aggression, and hallucinations. Methamphetamine has a very high addiction potential, and long-term use can cause lasting changes in brain function, affecting memory, emotion, and decision-making.